Today we are going to demonstrate how to examine tone, a very important segment in motor examination in a case of nervous system. First of all, we have to understand the definition of tone. It is the resistance offered by group of muscles for passive stretch or partially contracted state of group of muscles. So the point here to focus is, it is the assessment of group of muscles, not the individual muscle, which is done in power examination. So we'll see now. There are a few points which we have to remember basically. First of all, the patient should be at relaxed state, because if they are apprehensive, there might be falsely elevated or increased tone in the muscles, which might appear as hypertonia. So first, they should be at relaxed state. Then, whenever we are examining, always give support of the proximal segment of the limb when we are examining the distal segment, which will be moving freely. So this point we have to remember. Based on that, we will see how to examine tone in this patient. When it comes to upper limb, first of all, distally, what we have to do is, we have to grip the forearm properly. Then we have to hold the hand of the patient and we have to do these movements, flexion and extension. And we have to feel for the resistance which is being felt at the forearm. This is for tone examination of the hand, we can say. And one more way is just to rotate, or a circumduction kind of movement at the wrist joint will also help us in assessing the tone. Then we have to support at the elbow joint and we should grip the patient's hand as if we are shaking the hand. Then we have to do pronation and supination. So with this also we will be able to assess the tone of group of muscles. This is the second way. And when it comes to the proximal group of muscles tone assessment, just grip at the upper segment of the arm and do elbow flexion and extension. Here we have to grip it as if we are covering the half of the arm, so that we will be able to feel for extensors as well as flexors at a time. And remember, when we are doing this flexion action, we are feeling the tone of extensors, because according to the definition, it is the resistance offered for the passive stretch. So here the active movement is flexion. So we have to assess whatever is passive here, that is extensor group's tone. Similarly, when the extension happens, we are feeling for the tone at flexor group of muscles according to the definition. So just do it like this and always try to follow the examination at varying speed. For example, slow movements we have to do and some rapid movements we have to do, because the tone assessment will involve velocity dependence factors. For example, if it is velocity dependent, in case of hypertonia, we call it as spasticity. If it is velocity independent, that is, the resistance offered by the group of muscles will be uniform throughout the movement, that is independent of velocity, irrespective of the speed which we increase. That is called as rigidity, which is a marker of extrapyramidal involvement, whereas spasticity, in which the resistance offered will vary according to the speed. Usually we describe it as clasp knife spasticity in case of UMN pyramidal lesions. Just demonstrate the same examination on the other limb also, in upper limb. So we have to support at the arm and we should do flexion extension movements. As I mentioned, when doing flexion, we are feeling for extensors tone. So here it appears as normal or decreased tone, whereas when I am doing the extension, I am feeling for the tone in flexor groups, which is increased in this individual. You can see that this flexion movement is quite easy where compared to the extension. So we can say that the tone is more in the flexor group of upper limbs. So this is in the upper limb. When it comes to lower limbs, we can follow several methods. For example, first one is just we have to keep the hands at the mid thigh and just give the rolling movements and look for the floppy movements of the feet. It should be floppy if there is normal or even hypotonia. Suppose if we observe paucity of movements when we are doing this at the feet, as if it is not that floppy, that indicates hypertonia. This is one method. Then the other methods are, we have to just hold at the popliteal fossa and gently give the upward stroke like this. In that case, we have to look for the movement. If there is hypotonia, usually the heel will drag along the bedside. So it will drag before it becomes completely flat line. If there is hypertonia, when we give this jerk, there will be sudden upward movement of the limb. This is hypertonia. Otherwise, normally, as you can see in this patient, when we are giving this, it is normally going down. So there is no slow drag of the feet, as well as there is no sudden rise in the limb. So it is not hyper, it is not hypo also. It is just the normal tone. If the patient is voluntarily contracting the muscles, and if it is interrupting your examination, tell the individual to count some numbers backward so that we will be able to distract the individual. As we have done in the upper limbs, just grip the thigh as if you are covering almost half of the thigh so that we will be able to feel for the extensors and the flexors at a time. Now we are giving some passive movements. For example, when I am doing this extension movement, I am feeling for the flexor groups, the tone. Whereas when I am doing the flexor action, I am feeling for the resistance offered by extensor groups. So just do it for a few times and feel for the tone. On the other limb, आराम छोड़िए. I am able to feel when I am doing the flexion action, the tone in the muscles of extensor group is quite normal. Whereas when I am doing the extension action, the tone is quite low. So hypotonia we can say in the left flexor group of lower limb. We will see the tone in the group of muscles in the leg. So here what we have to do again, just support the proximal segment and grip the feet properly and just do dorsiflexion and plantar flexion and feel for the tone of group of muscles in the calf. So this will help us in assessing the tone. Other limb, if we repeat the same movements, we have to look for flexion, dorsiflexion and plantar flexion and feel for the tone. Actually in this case, because of old CVA, he has developed contractures. That's why we can clearly see that when we are doing this movement, there is no active movement, which is due to contractures of the musculature. So like this, you have to perform the tone examination at group of muscles at every joint we can say. In upper limbs, go from distal to proximal or proximal to distal, anything is fine. Just follow the same method as instructed previously. And always remember to examine the case with varying speed to assess spasticity and rigidity, especially in case of UMN lesions. And in LMN lesions, it will be very floppy and tone will be hypotonic. Just to summarize the finding in this case, on right side, we got almost normal tone even in upper limb as well as lower limbs. Whereas on the left side, mainly in lower limbs, when we did the movements at thigh, it was quite floppy. So we can say it was hypotonic. Whereas distally, due to contractures, we couldn't be able to assess the tone properly. Whereas in upper limb, we noticed that there was increased resistance, suggestive of hypertonia, probably UMN lesion, and the commonest reason will be stroke. So these are the positive findings in this particular case. Don't get confused why there is hyper as well as hypotonia. Actually, this is a very old CVA case. So because of the contractures or there might be some recovery which is leading to mixture of findings. Hope you have understood how to examine tone in motor system of nervous system examination. Thank you so much.